So our topic today is on Indigenous mothers' experiences of using acute care health services for their infants. So I'm going to begin by kind of addressing some of the questions that we're going to be going through or answering during our presentation. So to begin, how do Indigenous mothers living off reserves in urban areas experience selecting and using health services to meet the health needs of their infants? That's our first question. Now we'll move to our second question. What are the barriers that Indigenous mothers face that impact adequate and accessible healthcare? And our third and final question, how can a two-eyed seeing approach be used to bridge the disparity between Indigenous and non-Indigenous maternal healthcare? So I'm going to give a brief introduction into our article and kind of what we analyzed. So the goal of this paper was to understand how Indigenous mothers select healthcare services for their infants. Understanding this will help provide better services for Indigenous mothers. There was quite few barriers that we found that they face, which included that many reserves are located on rural areas where First Nations people have limited access to healthcare. And another big thing that we found in our article was that prejudice plays a big role against Indigenous mothers and is very prominent and limits their access to care. As one of the experiences that we heard were that doctors will not provide medication due to stereotypes of addiction. And so another thing that we were able to see in our article was that First Nations were observed to have used emergency department twice as often as non-Indigenous, as Indigenous children have seen to have a much higher mortality rate. So they gave us a statistic of 52% for Indigenous and 22% for non-Indigenous children. So just understanding these barriers and working towards eliminating them will better the experience for our Indigenous children and mothers. So now just going into the methods and how they integrated two-eyed seeing. So to integrate two-eyed for the methodology, the authors simulated an oral storytelling circle with Indigenous mothers in group discussions. So this was common in many of the papers that me and my group went through. So this approach fostered community between mothers instead of feeling isolated. Indigenous mothers felt more comfortable with providing information about some of the racism and discrimination they faced in these groups. And also, instead of focusing purely on empirical metrics, qualitative measures like experiences and feelings were taken into account. So the Western side of this kind of comes from how the research was published for the study. So it was a formal journal article. Now I'll hand it to my partner when we're on the same device.
Hi, sorry, yeah, I'm Liv. I'm just reading off the same, talking off the same device as Abteen. But in our paper, we found a few barriers that impact the experience selecting health services. So a couple are problematic wait times and hidden costs. So this includes buses, the cost of medication, the cost of walk-in clinics, and then some others are trusting relationships, racism, discrimination, and then holistic care, which is just the fact that westernized science, it's very much about physical health, whereas for Indigenous, it's more about the mental and the spiritual health. So it's impossible to move forward with two-eyed seeing without acknowledging the historical context of the medical system in Canada. So mothers were actively separated from their infants and put into residential, and their infants were put into residential schools. And then the residential schools themselves had poor health care for the children. Indigenous mothers were not trusted to be good mothers, and so they underwent forced sterilizations. And this isolates mothers from the communities, which increased anxiety and stress and led to poorer health outcomes for the mother and for the child. Some of the biggest barriers to Indigenous and science ways of knowing is the historical trauma, and it creates distrust amongst both groups. Due to residential schools, Indigenous mothers don't trust hospitals and westernized care. There are some barriers that we found outside of our paper as well. So health data in Canada combines Métis, Inuit, and First Nations data. And because of this, the information we have for Indigenous knowledge, it doesn't differentiate between the sources of knowing. Not all Indigenous people need the same care, and they're all different and have different spiritual and emotional needs. So basically, one eye is not explored in a thorough way. The Indigenous eye is simplified as if everyone's the same, and this prevents individualized healthcare. Now, in a lot of the papers we read as well, Neither knowledge systems were described very well. So the science system was almost entirely ignored, and the indigenous knowledge was mostly described as social or empathetic, but there were never any clear explanations. The integration was not well described, and most methods were about having discussions and simulating oral storytelling, but there was no other implications. And then there were also no recorded metrics about how this might improve healthcare for mothers. The last barrier I want to talk about or challenge is that we think there is not any clear definition of indigenous knowledge because it's been lost. So midwifery is an essential component to maternal health in many cultures, but it was criminalized in the 1800s because it was not respected in Western culture. So there's a lack of available indigenous midwifery services available. What this means is that one of the eyes we are trying to work with does not have a lot of readily available information, and it makes it difficult to integrate two-eyed seeing.
So unfortunately, we had found very little triumphs throughout the various studies we reviewed, but I would like to kind of go through just a few of the main important ones. So one of the triumphs that can be mentioned is the positive reputation that these Western health services had when it came to providing excellent care for the children. So these Western services provided specialized equipment and treatment directed towards children, as well as created a safe and comforting environment for the mothers and their children. These specialized approaches made mothers feel comfortable with waiting and confident in the care that they would receive. So now, through the author's method of providing open discussions to the participants to gather their insight of the matter at hand, a triumph was earned through these discussions as it allowed the woman to feel comfortable enough to address where the situation exactly lies in the mainstream with health services. Women were able to speak on their experiences and base their opinions on a variety of health needs that are of importance to them. So through discussions of hidden costs, racism and discrimination, holistic care, and overall trusting relationships with these health services, the author was able to highlight the areas that needed the most improvement. So now for our final triumph. So the final triumph that was discovered in these studies was the mother's access to additional resources provided with Western health services. So in one of the literatures that we examined, a variety of Western programs had been implemented in numerous indigenous communities with the mission to educate the women within these communities on the preventative actions needed to be taken to reduce fetal alcohol spectrum disorder.
Now, for some future opportunities, we were a bit disappointed to see the lack of clear integration between Western science and indigenous ways of knowing in many of the papers that we read. We think it would be important to include indigenous voices in maternal care and any future studies concerning two-eyed seeing. There are not well-designed methods or metrics. So for example, how would one determine if we were successful in integrating both knowledge systems? What does it mean to be empathetic? How do we integrate indigenous spiritual and knowledge system practices into healthcare? As of right now, a lot of the science literature written about maternal health care for indigenous communities is very superficial. So one way we could do this could be to directly include the National Associations of Indigenous Midwives. So an indigenous midwife will know the mother's needs better than what a Western doctor would. So it would be important to implement this into future studies. Another organization that could be used is called the Six Nations Health Services. So it's interesting to note that a lot of organizations that are proactive about indigenous health are already using what we consider to be two-eyed seeing. The Six Nations Health Services offers holistic healthcare to indigenous mothers. The organization should be consulted, or mothers should have the opportunity to reach out to them. With this organization, mothers can choose their birthing plan, how much of a Western science practice they would like to use. So this is a huge focus on women's autonomy. So mothers can choose which blood tests to run, how to get in contact with emergency services, and this would represent the Western science of knowing. But in the other way, mothers can communicate in discussion groups, be part of Facebook groups, and even talk to elders for emotional support. And this would incorporate the indigenous ways of knowing. Now, we also wanted to reach out to our author because she was the author of our primary paper, but author of a lot of similar papers we read too. And she gave us some feedback. So I just wanted to read kind of an email from her. So she says, two-eyed seeing really requires that both sides be interested and willing to work together to achieve a goal. And in healthcare, this isn't always the case. Patients aren't always committed to working together with providers and usually don't have a relationship with their provider. And health providers probably are also less likely to be motivated to eliminate power imbalances and judgments about patients' knowledge. So essentially what she's saying is that due to the distrust between science healthcare system and Indigenous mothers, it makes it difficult to integrate this two-eyed seeing approach. She also had some stuff about the future work, so some stuff we can do in the future. So it's to focus on a researcher's willingness and commitment to working with community members in an authentic way while breaking down power imbalances. These barriers are not easily combated in an academic space where productivity, research dollars, and outputs are valued more. Building relationships that the community wants and needs aren't valued the same way by universities. So that's a major problem and something we should work to in the future.
So now just to put it all together, I'm going to start off by mentioning some of the barriers that Indigenous mothers faced. And so one of them was the distrust in Western doctors and the racism and prejudice, which I had mentioned. Now, the methods in this paper and many others have integrated oral storytelling, but there was nothing else, no other method that we were able to find for this study. So there were also a lot of challenges that we had mentioned. So there's so much trauma from past history. Neither system of the two-eyed seeing approach is described well. The science system was almost entirely ignored. There was a lack of integration of two-eyed, and there was no recorded metrics about how this might improve healthcare for mothers. So now some triumphs were that oral discussion was proven to be effective and allowed the woman to feel comfortable enough to address where the situation exactly lies in the mainstream health services. Women were able to speak on their experiences and base their opinions on a variety of health needs that are of importance to them. Through discussions, the author found areas that needed the most improvement: hidden costs, racism, discrimination, holistic care, and overall trusting relationships between these health services. Now, again, some future opportunities would be to integrate the two organizations into our studies, so Indigenous Midwifery and Six Nations Health Services. Thank you for listening to our presentation.
Thanks. Very well done. Paul, your thoughts?
I don't have too much to offer on this particular issue because a little bit out of my realm of knowledge. But I would say that the fetal alcohol syndrome was worth noting, that through pregnancy that you're going to be taxing the health system all the way through should that take place in the birth of those kids. So I would say more literature and more acknowledgement that is the case. Thank you.
For sure.
Very well done again.
Yeah, well done. And really cool that you got some feedback from the author.
Yes.
That was nice.